hub in the near future, so we can share it with our colleagues across the system. But thank you and welcome everybody to our latest quarterly webinar from our LD network. So thank you for taking time out of your day, joining us today, and also thank you to our speakers who've also given up their time to come and share their presentations with us. And you can see from the first slide, we've really kind of pulled this one in from across the whole system. So thank you, everybody. Chris, could you move on to the next slide, please? Great, thank you. Bit of housekeeping. Can we get our cameras off and microphones on mute? Just helps with the bandwidth a little bit. Like I said, we are recording this session, and the slides are going to be made available as well, and any resources we talk about will be shared out after the event, just to so that everyone has access to that. Any questions you have, chuck them in the chat. If we can answer them kind of quickly within the chat, we will do. Everybody's keeping an eye on that, but also there is various points to stop throughout the webinar that we can have a pause and look at the questions in the chat and answer those as required. And then, as usual, kind of the typical confidentiality stuff applies. So next slide, please, Chris. This is our running order for today. We've tried to bring you a range of topics this quarter that are pertinent to your practice currently, and also things that we can provide you with direct support today and also in the near future. We're going to have to whip through at quite some speed because we've got quite a lot to cover in a fairly short space of time. But we will try and make sure there is space for discussion, like I said, and questions read. So once I'm done waffling on, Owen's going to provide us with a bit of an update on the reasonable adjustment flag. Then Helen's going to look at the new annual health check pre-health check questionnaire. I'm going to take you through some of the new resources from the Adult Learning Disability Health Service. And then Noah's going to have a discussion around ethnic minority annual health check project that they've been working on with the ICB. And then Olivia's going to be looking at Respect Plus and how that's been made accessible for the learning disability population. And at the end, Dr. Goddard's going to pop in, mention STOMP, and I think she has a request for the network as well. So next slide, please. So before I pass over to Owen, I just wanted to highlight to everyone on the call that it is Learning Disability Awareness Week this week. And each year, MENCAP sets a theme. This year's theme is Do You See Me? This is focused on people with learning disability being heard and valued within society, and obviously kind of including that the healthcare system. So we hope today we can just do our bit, our part in trying to raise that awareness and think about how we can develop our practice, share resources, knowledge, and consider how we can better meet the needs of our patients with learning disabilities and some of the health inequalities that they might face. So I'm going to pass you over to Owen now from OneCare, and he's going to talk about reasonable adjustments.
Thanks, Sean. Nice to see you all today. My name's Owen. I work at OneCare. For those who don't know who OneCare are the GP Federation in BNSSG. We're the biggest GP Federation nationally. And I work on the digital team at OneCare. My background is really within working in general practice. So I worked for 13 years in practice management. So most of my time spent on the kind of practice floor, so to speak, and had lots of experience administering LD health checks and things. So we're here today to talk to you about the Reasonable Adjustments Digital Flag, which is a new requirement being mandated nationally. Julianne, I think you know everyone, but do you want to introduce yourself? Julia, yes. I'm going to do most of the talking, but Julianne's just going to introduce the first slide and then pass back over to me. So I'll hand over to you now, Julianne, if that's okay.
Yes, hi everyone. Thanks so much for joining us today. I'm Juliana Mattis, I'm a GP at the Orchard Medical Centre in Kingswood and the ICB lead GP for autism and learning disability. And I had a little bit of input in Owen's project. And despite really promising myself this time not to talk, here I am presenting a couple of slides. So just to set the scene a little bit. So there's a long-running project with NHS England to create a reasonable adjustment flag, so a marker in the electronic records, ideally across all the system, primary and secondary care, that highlights what reasonable adjustments a person needs, so all services are aware and can also input in this adjustment flag. That project's been running for many, many years, and it's now recently divided in two parts, a national two-part solution that will come in the coming years. And we've now been tasked with finding some local solutions to this problem. And then One Care done an absolute fantastic job to move that away from us as individual practices to create our own digital flag, but to offer us a digital flag we can use within our EMIS systems. And just a really brief next slide to just explain about reasonable adjustments. There are small changes to our service we can make to help people who have a disability or vulnerability to access our service as anyone else can. And that, of course, includes people with a learning disability and autistic people. And why should we focus in this group of people? Because the average life expectancy is still quite low compared to the general population. It's 14 years shorter for men and 18 for women. And we will talk about people from ethnic minority backgrounds, and the numbers are pretty shocking. And LEADER reported last year that the median age of death for this group of people is still only around 34 years. We know the people with learning disability are more likely to suffer avoidable deaths compared to the general population. And of course, people with learning disability and autistic people have a higher rate of physical and mental comorbidities, and they do access our services probably significant less than they actually should. And also, I cannot go without showing you our Remedy website. There's a lot of resources for the annual health check and for health action plans and general information on learning disability. Give that a look in. And I'll hand over back to Owen to talk to you more about the reasonable adjustment flag.
Thanks, Julianne. That's really helpful. Next slide, please. So Julianne's talked to us about what reasonable adjustments are. I'm going to tell you a little about the digital flag aspects of reasonable adjustments. So the RADF, as another helpful NHS acronym has been shortened to, is a visible indicator on a patient's medical record. And that flag highlights the need for specific reasonable adjustments based on a person's condition. At the moment, this digital flag is for individuals on the Learning Disabilities Register or with a recognised diagnosis of autism. So that's the cohort at the moment, and it may be that is extended. The sort of chat nationally is that it's likely to be extended to include all recognised disabilities, but at the moment it's for those two cohorts of individuals. By having this information readily accessible, it's intended that providers can tailor their services to meet the individual needs more effectively. So it's probably also worth noting that this isn't just a courtesy. These are becoming mandatory. A mandatory requirement from NHS England, mandating that reasonable adjustments must be made to ensure that people with disabilities and autism can access health and care services on an equal footing with everyone else. So I think everyone is in agreement of how important this work is. The challenge is just regarding how we make it happen, sort of locally, like Julianne described, in the absence of any sort of national tools that are being developed or in the process of being developed. The use of the reasonable adjustments digital flag allows us to be more productive and anticipatory with adjustments being made before a person presents for their care or treatment. So it's really about being proactive and putting in place these adjustments before a person with disabilities or autism arrives for their appointment or treatment. And this approach makes sure that the necessary accommodations are already available and reduce delays and improve overall experience. Next slide, please. As described by Julianne, there are two sort of phases to this work. So phase one is where we are at the moment, but the key to this phase is really about those 6 steps. So I'll just run you quickly through those 6 steps. Sorry, if you could go back, if that's okay. Thanks ever so much. So the first step being identify. So the intention is for every patient interaction, whether it's an appointment or a phone call or a follow-up, that providers should ask patients within these cohorts if they require reasonable adjustments. This is to make sure that no needs are overlooked and that every opportunity to provide accessible care is taken. The second step is record. So this is about using agreed codes. So once needs for an adjustment has been identified, it's important to accurately record the information and use a standard set of codes to ensure that the data is consistent and can be easily understood. The third stage is the flag itself. So that is the reasonable adjustment digital flag, is making it visible. So the step is about making sure that it's seen on the patient's records and is flagged to all healthcare providers as much as possible who interact with the patient, and ensure that everyone involved in the patient's care is aware of the necessary adjustments. Share is the next step. It's quite a challenge. It's an important, really important requirement, but at the moment you'll probably be aware there are a number of interoperability challenges with regards to digital systems used across the system, and being able to share them effectively is one of the challenges that we will face as we sort of roll this out across system providers more broadly. The fifth stage is about meet. So that's all about taking the actions and implementing the necessary adjustments, and providers making every best effort to accommodate the required adjustments. And the final stage is about reviewing. So making sure that you're able to review and be dynamic at each patient contact and ensure that the care remains responsive and adaptive to patients' needs, because as you all know, they can change over time, so they're not necessarily set. So next slide, please. So what have we actually done? We've talked to you about what reasonable adjustments are, what we needed to do, and now this is what we've actually done. So in the absence of the national reasonable adjustments flag, which the future is uncertain, but you'll have heard of Connecting Care. It may be that nationally it's driven through the summary care or shared care record, but at the moment, in absence of that, and in order to meet the requirements of phase one, we've taken the sort of proactive measures to ensure we still meet the requirements which we set out at the beginning. It's really our best effort at a workaround whilst we await the national solution, and we understand that from calls with regional colleagues that we are leading the way within the system within BNSSG, so it feels like a positive news story really for this region, which is great. We've tried to do this as broadly as we can, so OneCare, in collaboration with the lovely Julianne, who's been incredibly helpful, who's the LD lead for BNSSG. We've also involved the ICB digital team and Sirona, and Nikki Powell, who is part of the NHS England Southwest Learning Disabilities and Autism team. We've developed an EMIS solution for the practices and Sirona. So for those of you who aren't aware, EMIS is the name of the general practice electronic patient record. It's the sole use across the system, so we've only got one provider and we all use EMIS, and that's across all 67 practices and over 100 sites throughout BNSSG. EMIS Community is also used by the community provider Sirona, meaning that we're able to share resources with them as well that we create, which is obviously fantastic. The resource we've developed is a pop-up feature for use within EMIS Web or EMIS Community, and it's aimed at prompting clinicians and other staff to do what we've set out, really, to fit the bill, to assess whether individuals with learning disabilities or autism require reasonable adjustments, and then it tries to hit all the sort of metrics set out in the 6 steps, really. So it's still a work in progress, but we feel like it's a an effective workaround and a good solution to respond to these new requirements, and something we're able to put together quite quickly that hopefully fits the bill. I've probably done enough talking for now, so it's probably helpful for you to see what it looks like in action. So I'm going to ask to play the video. So this is a short video where you'll see what the actual reasonable adjustments look like. And a big shout out to my colleague Hannah, who is the one that has done all the hard work to actually, develop and write the protocol in the background. There's a lot of work goes on behind the scenes to make it happen, and Hannah's the one that's done it. So if you could play the video, and then we'll come back.
Hi everyone, my name's Hannah. I'm one of the digital consultants at OneCare. I've been involved in creating the reasonable adjustment digital flag, and the point of this video is just to demo the second version. So the second version contains 3 resources. We've got 2 protocols and 1 template. So the protocols, this one, codes added to record, is triggered when a learning disability or autism code is added to a patient's record. This one, the codes on record, is only triggered when a consultation is added to those patients who already have an autism or learning disability code on their record. And then reasonable adjustments log is just a consultation template which allows people to record reasonable adjustments and the detail for them. So to show you an example, if I go to this test patient, as we can see, they don't have any problems on their record, so no autism or learning disability codes. So if I go to add an autism or learning disability code, what will happen is once that code has been added, a yes, no prompt will appear. This patient has no reasonable adjustment codes on their record you wish to add. If no is selected, then it will end the protocol. If yes is selected, then it will launch the reasonable adjustments log. This just gives some examples of reasonable adjustments, the reasonable adjustment code, and a place for somebody to free text what the detail of the reasonable adjustment is. So patient needs quiet waiting room. So when I save that, once saved, this is what it looks like in the consultations, and a reasonable adjustments alert is added to the pink box. This alert was created by Arden, so we're just using it in conjunction with our resources. This alert shows what reasonable adjustment code is added to the record, what data was added, and any detail that was added to the free text. Now, with this patient that now has an autism code and a reasonable adjustments code, if I go to add a consultation, it will pop up to say the patient has a reasonable adjustment flag on their record. Please see Arden's reasonable adjustments coded alert in the pink box for further details about the reasonable adjustments needed. The detail of the reasonable adjustment isn't in the display text, is that's a limitation within EMIS. So we've just created this pop-up to direct the user to the pink box, just so it's a bit more visible. Once you click OK, obviously you can continue with the consultation as usual. Again, another example is when the patient has an autism or learning disability code on the record, but does not have a reasonable adjustment code. When I go to add a consultation, again, the same yes, no prompt will appear to ask the user if they want to add a reasonable adjustment, or if they don't. If they don't, it will close. If they do, it will take them to log as seen before. For the purpose of this, I'm just going to select no and cancel out the consultation. Now, these protocols are meant to work in conjunction, and they both have the template embedded within them. However, if there's any changes or amendments you'd like me to make, please let me know. Thank you.
Thanks to Hannah. That's our demo video. So hopefully it's helpful for you guys to see. Next slide, please. That'd be great. Hopefully helpful for you to see it in action. In addition to the protocol which we've just watched, we've also it's worth mentioning that when we share the protocol, we can use a feature in EMIS Web called Resource Publisher, which means that we can share directly to all practices across the patch and change it in one single place, which obviously counters the risk of multiple different protocols being amended and different across the system. So that's another big positive. In addition to the protocol, we've also provided practices with all the reasonable adjustments digital flag resources in a single location. So if you could move to the next slide. This is contained within the general practice intranet, which is called TeamNet, and this single place includes resources such as practice posters and different things that will be helpful in the implementation of the reasonable adjustments flag. And the final bit is just one of the important pieces to provide to the practices, which Julianne's just going to touch on before we finish, is providing a template policy for the implementation of this digital flag. So I'll just hand back to Julianne, and then we'll take questions if that's okay.
Perfect. Thank you so much. That was really clear. Can we go a slide further? We got stuck a little bit. Yeah, this is the TeamNet resource page I just talked about, and what you can see here is that there's the reasonable digital flag, some information, but also some posters to put up for your staff and for your patients. Next slide. And the other requirement from NHS England is that we don't only just have a reasonable flag, but we also have a practice policy. And with the help of Nikki and the team, there is a sample policy you can then adjust to your own practice. Please read it, please adopt it to your practice and your needs, but that will also go onto the TeamNet page. So hopefully with everything you need to be compliant in one place. And we're really happy to take some questions. And there is one from Nicholas, and I think that's for you, Owen, how we're getting this uploaded.
So as I discussed, across the system, you just need to activate the sharing, and then for practices, this can be shared via resource publisher. So it's a protocol that just needs to be activated then. So that should be fairly straightforward, hopefully.
And Marissa asked if it's available to use now, and we test run this at my surgery, uploaded it, and it's ready to go, works.
Yeah, so Nick, lovely to see you. Yeah, it's available from now. We're going to put out some comms. We've just been developing this very recently, and Julianne has adopted it as a first of type in her practice, and I think we're now happy to share it more widely. So we're going to put something out in the bulletin, either this bulletin on Tuesday or on Thursday, to share it and direct people towards all the resources. So yeah.
And we were hoping with the practice policy, there's a little bit of some kind of legally stuff there. So we're really hoping this is coming out in the next weeks too. We'll let you know via the GP bulletin.
And Nick, in terms of it being mandatory, yes, I think the requirement is supposedly from this new QOF year, 1st of April. I think it's fair to say that we're ahead of the game in terms of what we've created. I don't know if you'd agree, Julianne. But yes, I think it's a requirement that's needed, but that's not to say at the moment I think it is happening across the system, and I think we are kind of leading the way with it. Is that a fair summary of that, do you think, Julianne? I think
yes, I think so, and I think we were quite rapidly off the mark. You know, it's like things get sprung onto us, especially in primary care, and they should have all have happened yesterday. So I think we are. I think the deadline was something like April, but I mean, realistically, I don't think anyone's done anything as comprehensive as we've done yet.
Agreed.
Link in the chat, is that Rebecca to TeamNet, to the TeamNet site?
Yeah, the RADF link you've got there on that page that's currently up is not, obviously we can't click on that.
No, you can't click on it. It's we can put it in the chat, but just bear with us. Yeah, sure. Just bear with us finalizing things.
Sure, thanks.
It always takes a little bit longer than you're hoping for.
So yeah, the only thing we're waiting for in terms of adopting and going out to practices is what Julianne described, which is the policy, the practice policy to go with it. So we're just we're waiting for one question to be answered, aren't we, by Nikki, in terms of legal requirements. So that's what's stopping us at the moment, but it should be imminent, hopefully. So
Are
unless
there
there are
any
any,
more questions? Because otherwise, I think we can
yeah,
hand
unless
back
there,
to Sean with 4 minutes to spare. Sean, I'll just
yeah, I
like
think
to point out.
I think I'm to hand on to Helen now to keep things running. So I'll move over to Helen, who's to talk about the pre-health questionnaire. So over to you, Helen.
Perfect. Thank you both. So my name's Helen. I'm the Communications Officer for Healthwatch Bristol, North Somerset and South Gloucestershire. And for anyone who hasn't heard of Healthwatch, BNSSG Healthwatch is both a charity and a statutory organisation. There's one of us in every area of England. Doesn't always tie in with ICBs, but we tie in with the BNSSG ICB, and we're also a statutory organisation. We were formed after the 2012 Health and Social Care Act after the Winterbourne scandal, which was just up the road in South Gloss. So back in 2020, my former colleague created a pre-health check for people with a learning disability and their carers to take with them to their annual health check. And it was designed to kind of help people make the most of their health check so that people could kind of, whether that be the person with a learning disability, their carer, their supporters, their family, their friends, so that they could go into the health check with a little bit more of an idea as to what, one, they would like to tell the GP about, and two, what they would like to get from it. We go next slide, please. So that's what the front cover looks like at the minute. And this was initially created in 2020, and I've recently been working with Julianne and also Zoe Slinger, who have been invaluable in helping us update it. So can we go to the next slide, please? So there are lots of things that we wanted to update from 2020. So, I mean, one of the key ones that we spent quite a lot of time talking about is how to navigate questions around smoking, vaping, all of those kind of things. And we're really pleased to be able to co-produce it initially, although this was at the middle of 2020, so the kind of right into the pandemic, but we were really, really lucky to be able to work with one of our volunteers called Gemma, who anyone in South Gloss may have heard of. She sits on the South Gloss Learning Disabilities Partnership Board, and she's been fantastic in helping us working through this and improving it. So we've improved the checklist in a number of ways. We really, really wanted to bring it up to date. Like I said, it was quite out of date. So one of the questions that I can think of was, are you drinking 6 glasses of water a day, or are you drinking 8 glasses of water a day? And Julianne and Zoe's input was invaluable in that. And then we were able to recreate this question, and we thought it'd be really useful to get people to say, you know, what are they drinking? Are they drinking Coke? Are they drinking squash? Are they drinking water? Are they drinking, you know, alcohol? There's also been changes around, changes the checklist around bowel cancer screening, cervical screening, mammograms. Lots of those weren't included in the initial one. So it's been great to be able to include those. And we've also been able to be a little bit more specific around things like sleep, eye checks, hearing checks, weight, diet, things like that. Can we do the next slide, please? So, like I said, this was initially created in 2020, and then in 2021, it had a real impact, which we were very pleased about, and that was, you know, all credit to GP surgeries sharing it. We were able to achieve, I say we, BNSSG, were able to achieve the highest annual health check completion rates in the Southwest. And then in 2023, again, we had a really, really good success rate with the annual health checks. And also the fact that people are now leaving having a health action plan. which is another page that we've included on the updated checklist that wasn't on the original one back in 2020. So I guess kind of in summary, we've kind of drilled down on some of the questions. Some of them have been made more specific. Some of them have been made clearer, I think. And in terms of how it's been shared now, I know Juliana's put it on. I'm not that well versed on
Remedy.
Internal. Thank you, Julianne. So it's on Remedy, and we've recently just kind of put it on our websites and stuff. Lots of my colleagues go to kind of groups that have people with learning disabilities, so we're going to get lots printed out, laminated, and yeah, it's been really, really excellent to update it, because it was surprising how much needed to be changed from 2020 to 2024, especially around things like vaccines. So at the minute it runs to about 18 pages. Like Julianne said, it's on Remedy, and we're hoping it will be really, really useful for years to come, and that we can update it as and when it's needed now. Yeah, if anyone's got any questions, please let me know.
Thanks, Helen.
Thanks, Sean.
Looking in the chat, I can't see any questions just yet. If any questions do come up as we move on, Helen will be around to answer them in the chat, and we will have a further kind of wrap up question session at the end. So if anything kind of springs to mind, we can answer them later as well. So thank you.
Thank you all.
Right, so going to move on now to some of the new resources that have been developed from the Adult Learning Disability Health Service. I guess I don't know if everybody knows, but through the transformation of Sirona, the Community Learning Disability Team, the previous CLDT, went through a bit of a change of name. So we now identify as the Adult Learning Disability Health Service. So you'll be seeing the ALDHS acronym a lot more as we kind of continue to expose that. But you'll see it on Remedy as well, and you'll see it on all of our documentation. So there's a few new resources that we've made, and this being in conjunction with Julianne and the ICB. We've also linked with People First, our service user groups, as well as kind of wider partners across the system. So the three main ones that we're gonna talk you through today is the Annual Health Check Toolkit, the reasonable adjustment posters, which Owen showed that's on TeamNet, and actually, Owen, I think I need to send you an updated version. I spotted something, so I'll get that across to you. And also, there's some new heatwave easy information that we've been working on as well. So if you change the slide, please, Chris. Firstly, we need to. I want to show you the Annual Health Check Toolkit. It follows on quite nicely from what Helen was saying. So the end of last year, Julianne identified sort of a looming issue, the fact that the Royal College GPs took down the Annual Health Check Toolkit that was available for primary care to have and support with the completion of annual health checks. And with a kind of a lack of that guidance, there's a real void in the guidance that you guys receive. And obviously, Julianne and I have been we put on the annual health check training back in November. We plan to kind of continue that training annually, but in the interim of that training, there is no toolkit to support with the completion of. So we decided we'd look at developing a local version, a BNSSG annual health check toolkit to support primary care in completing annual health checks. I was hoping to have a completed toolkit today to run through, but at the minute it's in a draft form. It is final draft. And so actually the ask today is to see if we can have some volunteer practices to take a look at our toolkit, apply it to practice, and give us some direct feedback so that we can influence the final design of the toolkit so that we can get the most use. Not from Rebecca. We can get the best use out of that toolkit and make it sure it's as applicable to you guys as possible. So yeah, the aim is to get it tested across the summer and make sure that it's available ready for that fourth quarter rush that we typically see with annual health checks. And and then yeah, that hopefully we can have that ready for you. So next slide, please, Chris. This is not our toolkit. This is actually the London-based annual health check toolkit, which is available now. The link's there. The slide, it will be in the slides when these are shared out afterwards. And this is available today, and this is what's formed the basis of our toolkit. This has been readily shared after the Royal College GP's toolkit was taken down. And I think it's a good interim solution to ours being completed, but there is limitations within it, and especially after reviewing it in order to make our one, there's bits of information that are missing, specifically around the exact kind of step-by-step of how to complete. There's also excess information in there, and there is also London-centric information in there, so it's missing out on a lot of the local links. So what we aim to do with creating a new toolkit is solving some of those issues. There's some functionality issues, making sure it's more local, and actually it's directly all the information in it is directly impacting on how you're completing your annual health checks. Next slide, please, Chris. So like I said, we are working with the principles of that London toolkit, and then we're applying them to our local version. We didn't want, I was acutely aware that this isn't just a Bristol, North Somerset, South Gloss issue. This is a nationwide issue. So we have reached out to our partners across the Southwest, and we're working with Cornwall to pool resources and make sure that we're not just making a BNSSG version. We're trying to fix a wider issue there as well. So the toolkit that is available is made in conjunction with Cornwall. We also wanted to kind of consider the needs of our audience, and we tried to make the document as simple and as easy to navigate as possible. So we've reduced the length of it from the London one, and we've also made sure that the messaging on each topic that we cover is as clear as we possibly can make it, and it's as easy to function as possible. There were some issues with the other toolkits around functionality, and we really wanted to focus on a how-to rather than a go-do approach. So we wanted to make it as practical as possible. We wanted to make sure that there was real clear step-by-step guidance, and we also wanted to make sure that there was lots of very clear, helpful links into various resources, but also into the local area. Next slide, please, Chris. So this is a screenshot from the current toolkit draft. I wanted to kind of show you a couple of pages to give you a flavour of what it looks like, and also how it operates. So that top bar that you see with all the various titles, that is the navigation system. We've made it so that every single topic has one page of, so you don't have to go sifting through multiple pages. It's just one page on. So this is the LD definition GP register guidance. We've also got flu information, vaccinations, how you prepare, which will include the pre-annual health check questionnaire, reasonable adjustments in the flag, how you undertake the actual, how do you undertake it, what's the steps involved in that, some syndrome specific checks, medication reviews, transitions, health action planning, some specific local information around your local learning disability teams, and that's where the regional variations will come into it, and then some additional resources and links will be made available. So it's only 11 pages, so we have shrunk it down from the other toolkits. We have tried to focus it in on one page per topic, and we've tried to make it as helpful as possible. You'll see at the bottom there's that footer as well, which is for all LD patients to ensure they're coded correctly on EMIS. So that's just a regular prompt on every single page to make sure that we are getting the correct SNOMO codes on EMIS, and which then impacts on the LD register. And we also are reflecting the information within the toolkit on remedy and remedy on this. I'll talk about that again in a second, but we want to make sure that we are consistent in our messaging. So the training that we provide in November, any future training we provide, the information on remedy and this, it all correlates and crosses over with one another. So we are consistent in how you are receiving information. Next slide, please, Chris. So this is the undertaking section. The previous annual health, the toolkits in London, they actually didn't go into such a clear step-by-step process of how do you actually complete it and what are the considerations you need to have, and actually what are some of the possible outcomes you can have. So we wanted to make sure that there was a really clear page in there for primary care to follow. So that's in there. Next slide, please, Chris. Right. So, and then another area that we identified that was missing from other toolkits was syndrome-specific checks. And obviously, if we were to include all the information about all the sort of prominent syndromes, we would end up with a massive document. So this is an example of a page where we've tried to we've put in real links out to specific resources and information where you guys can find the most appropriate information in order to support your your health check completion. Next slide, please, Chris. This is just an example of that additional information, and this is we can consider kind of what are the links within it, and where do we need to signpost onto, and what documents would be appropriate as well. So I'd be really interested in some feedback on that. Next slide, please, Chris. So we have a document, a completed draft document, and we are looking for some feedback. And thank you for those that have already said that they're interested in taking part. If you do want to, then please just email me. I dropped my email in the chat earlier on. I'll put it in there again, actually. Email me, let me know, and we can involve you in the trial of this document. And the main thing is that we want feedback of the functionality of it and how it's supporting you with completing your annual health checks, because then that will directly impact on the final version of the toolkit, and then that will impact practice across the Southwest as well, not just in BNSSG. So that's the toolkit. Next slide, please, Chris. So I'm going to move on from the toolkit onto the posters for reasonable adjustments. I'm not going to go into reasonable adjustments. This is Owen talked about that earlier, but we were thinking about reasonable adjustments and how we're supporting primary care with implementing reasonable adjustments. And there's obviously the flag that's come about, which did have some prompts in it, which I saw, which is really great. But I'm acutely aware that when we deliver training around reasonable adjustments, it might be some time before you then have to think about it for a specific patient, or it might be that actually it's quite challenging to think of reasonable adjustments that you could apply to your practice, especially within your area of care, or within your specific building. So we wanted to provide like a tangible examples of what reasonable adjustments could be and how they could be implemented within primary care. So next slide, please, Chris. So this is a poster that we've made. It's aimed at staff. So this wasn't the intention of it is not to be put out on waiting rooms, but to be held within staff areas. We made it nice and colourful and eye-catching so people will be drawn to it. The intention is that staff kind of over the course of time you are reminded of various reasonable adjustments that could be implemented for your practices. These are for your patients. These are just examples as well. It's not to say that these are things that you have to do. Obviously, reasonable adjustments are specific to any individual, and so this print it out, put it up in your practices wherever your staff are, and kind of have it there as a consistent reminder, not just for your learning disability patients as well, but other patients who may also benefit from having reasonable adjustments. The QR code in the corner will take you to Remedy, and again, all of this guidance will be reflected on Remedy. And also you've got the link there for the Adult Learning Disability Health Service Advice line at the bottom, and that's a space where you can call up and speak about specific patients to the learning disability team, and have instant kind of access to an MDT of learning disability professionals, and they can advise on reasonable adjustments as for specific cases, or kind of more generally for your practice as well. So it starts 5 days a week, Monday to Friday, and that's there. So this poster is ready. It's on Remedy. You can find it on there, and obviously we'll share it out with the pack after today as well. Next slide, please, Chris. To support the staff poster, we also made this slide, which is the target audience is your patients and carers within your practice waiting rooms. This could be put up onto your screens or printed out and put on the walls, and it's a prompt because our patients aren't always confident at asking for reasonable adjustments or necessarily know that they can ask for reasonable adjustments. So this is an empowering slide piece of communication to our patients and carers to say, actually, if you or the person you're supporting requires reasonable adjustments, have a chat with the practice staff and see actually what reasonable adjustments would would be beneficial for that patient in order to have access to the healthcare that they need. So again, this one's ready, available on Remedy, and can be accessed and shared. Thank you, Chris. Next slide. So the last thing I want to share from the Learning Disability Service is heatwave information. So LEADER, the mortality review program for people with learning disabilities, identified a significant spike in excess deaths during heat waves, and they were able to drill that down right down to the week of a specific heat wave. And so there's a real drive to ensure that we're supporting and empowering our patients with learning disabilities to keep as safe as possible during hot weather. There is national information available. There is easy read information available from the government websites that you can find, and that's the links there, and you can share. That's fine. But we've made a local version, and the reason for that is the national information was very broad in depth. So it's actually a 9-page document, so it's quite long, because it didn't just cover heat exhaustion, heat stroke, and how to keep cool. It covered other topics as well. But also we're building a local learning disability branding with the joint work between Sirona and the ICB. And we're being consistent in how we're presenting information, which is becoming familiar to our patients and service users, so it's easier to identify for them. And it also means that we're able to then reflect our easy read information into other digital formats as well. So for this one, we have made a video to go with it. So next slide, please, Chris. So this is the easy read information. So it's as opposed to the 9 pages that is the national one. It's only 3 pages. 1 page on how to stay safe in hot weather, 1 page on heat exhaustion, and 1 page on heat stroke. And it's all consistent with how we present our information locally, using photo symbols. It has been presented to people first, our service user groups, and they've had a say on the text and how accessible the information is within it. And they've had a direct impact on the final outcome of this accessible information. The links in the slides, and we'll share it out with the pack at the end as well, but this is ready to go. We also thought that this could be shared out via ActiveX text as well. So if you wanted to text out resources to your service users or their carers, just attaching this as a link within an ActiveX text, and then we can easily kind of send it on to all of our patients on the Learning Disabilities Register. Next slide, please, Chris. And then finally, on heatwave, this is a couple of screenshots from the video that we've produced. So it's the same information as the easy read information, except for each line we've broken down into 1 picture, 1 sentence with a voiceover, so that the information is then very clearly given across. And that's just an identification that not everybody digests information in the same way. And this just allows another method of people to take on board this information. And this is just under editing. It is all together. It just needs kind of a bit of final editing to be done. And as soon as that's ready, like the GP print, the heatwave printed information, we can share out on the bulletin when it's available and up on Remedy. Next slide, please, Chris. I think, yeah, that is it. So this is just a spot really for any questions based on the toolkit or heatwave or reasonable adjustment posters. And I haven't looked at the chat at all.
Sean, hi. I have answered a few questions from the chat. I hope that was okay. I think there's the question if we're integrating the toolkit into EMIS, and I think it's something that will sit alongside EMIS, isn't it? It's more for the clinician who's doing the health check to guide them along the health check. And I think EMIS and Ardens both have templates you can use for the actual health check. So I don't think there's any plans of integrating this with EMIS.
It's not a template. It doesn't replace the EMIS or the Ardens template to complete the annual health check. This is a body of information to support with the quality and the completion of that annual health check. And really importantly, kind of within that toolkit, we wanted to make it as practical as possible and tangible to your practice as possible. And so we've included a lot of links into various resources that will support with the completion of annual health checks. Lovely. Okay. There will be time later on for more questions if needed, but I'm going to hand over to Noura right now, who's from Autism Independence. Thank you.
Thank you. Hello.
Hi,
Vicky, you're on
Vicky.
mute.
Welcome. If you're talking,
Okay.
you're on mute, my darling.
Sorry, my name's Vicky. I'm gonna Noura and I are gonna do a tag team to do this presentation. So I manage the leader program, and Noura, do you just want to introduce yourself as well, please?
Yeah, my name is Noura Abi. I am a director of Autism Independence, a community organization that support families from ethnic minority.
Thanks, Noura. Next slide, please, Chris. Okay, so Autism Independence and the ICB have collaborated to run a program over the last 6 months. The reason that we've done this project is a key finding from our leader report, as well as the national report, is that people who have a learning disability and also have an ethnic minority die at a younger age in comparison to the white British ethnicity backgrounds. So from the most recent annual report that will be published later this year, 96% of our completed leader reviews had a white British ethnicity. And as of now, we have over 5,000 people who are currently registered on BNSSG learning disability registers. However, the ethnic minorities, there's a very small percentage of those that are accessing the learning disability register and annual health checks. So the reason for this project was to raise awareness in our ethnic minority population of the learning disability register, as well as the annual health checks. Next slide, please. So the project is really recently just finished, and there was 2 key aims. So the first one is to raise awareness, and Noura's going to explore this and go into it a bit more depth in a minute. But basically, Autism Independence are really great with integrating themselves in communities. So there was a really strong focus on the message being taken into communities rather than asking carers and families to come to us. So the whole thought process of this is that if we attend different community centres where people from an ethnic minority visit, they feel comfortable, then hopefully they feel more comfortable, and they're more able to speak freely about the barriers that they have to accessing our healthcare. The other aspect of this project was if families and carers struggle to navigate our health system, then colleagues of Autism Independence would support them in phoning up or doing e-referrals to GPs and booking an appointment for the annual health check. And on the odd occasion, they've also supported people to sit in and go through the annual health check as well. Okay, I'll hand over to you, Noura.
Thank you. So in March, thank you. In March 2021, Autism Independence have been commissioned by BNSSG to carry out a pilot study with individuals and families with lived experience of learning disability or autism from ethnic minority groups. From this study, we also found people from ethnic minority had little understanding of annual health check. So as part of the awareness raising process, the annual health check navigators at Autism Independence were able to gather information of what the barriers were by going to community safe spaces. All materials developed were culturally sensitively screened. As part of that process, promotional leaflets were developed in Arabic, English, Polish, Somali, and Urdu. These were in the form of digital posters, banner stand, as well as easy read annual health check information leaflets. A video is also produced explaining the importance of the annual health check, who it is for, and what to expect at an annual health check. Next slide, please. So Autism Independence team know their communities, and so they visited schools, Hindu temples, community centres and events, mosques, shopping malls, with the sole focus of raising awareness of annual health checks for carers, families who might be living with someone who has a learning disability. Next slide, please. The team provided practical support to families, carers and individuals to navigate the health system to ensure the person who has a learning disability was on the GP's learning disability register. Once on the register, support if required was provided to attend the annual health check with the carer of person with a learning disability. It's important to note that the recruitment process for this project has been culturally sensitive, so hence the success of what it has achieved. This meant that Autism Independence had a Somali and Bengali speaking team, as well as volunteers and directors from different ethnicities. Next slide, please. So we found that some people that were already on the learning disability registered and accessing the annual health check. Once they are in the system, in some cases, this appeared to work well. It's important also to note that this is purely anecdotal and further research into this would be needed. Carers' feedback suggested for those already on the learning disability register, some people do not receive a written health action plan, and on occasion, the actions following an annual health check have not been followed up. Qualitative data following the project suggests that there are many barriers to people accessing annual health check, and from a knowledge perspective, there is a lack of knowledge from carers, with individuals not always understanding the importance of annual health check, thinking instead that it's just another GP appointment. Some carers and families struggle to accept the individual's learning disability diagnosis, and in some communities, a learning disability is stigmatized. Next slide. Thank you. Some ethnic minority families include multiple children, but in a small bedroom accommodation. For these families, there are competing basic need priorities of housing and food. An annual health check, when the person appears to be well, might not be a priority compared to having a roof over your head and food on the table. When housing is not stable, people are required to move house at times frequently and consequently change GP as well, leading to a delay in health records being transferred and potentially people missing appointments. So this is not just a health issue, it's a much wider issue. Next slide, please. So carers who have childcare commitments, who also support a person with a learning disability, struggle to accommodate the competing priorities for both the child and individual to attend GP appointments. Many carers and families have mental health concerns because of the pressure they are facing and the fear that services might stop or removed. From a cultural competence perspective, some health workers were not culturally competent and sent GP reminders in a written format that was not in an accessible language. Although many individuals speak English, it does not mean they are able to articulate themselves or read English. Text messages was frequently used as a way to communicate, and again, this technology was a barrier, so messages were gone unread. Next slide, please. So from navigating the health system, it is extremely difficult. So, for example, booking appointments varies by GP. Some taking electronic referrals, others telephone booking. Automated services are difficult to use, especially for individuals who have a learning disability. Many healthcare workers were not often aware of the learning disability registrar or annual health check, which deter individuals, carers, if they feel resistance, lack of understanding by healthcare workers that an individual does not need a formal learning disability diagnosis to be eligible for the learning disability registrar. Next slide, please. So in terms of moving forward and considerations, culturally equip healthcare professionals to make accessing annual health checks is easier. Ensure GP receptions access further training, such as the Oliver McGuane mandatory training, and are able to apply the learning from to the day job. Be provided with cultural intelligence training for health professionals, maximizing feedback and contribution by experts by experience and local people to complete service delivery. GPs to ensure all communication is provided in an easy read format, including the text is relatable to a person from ethnic minority background. And as a reasonable adjustments flag if someone has a learning disability or has communication issues. Ensure annual health checks are easier for people to access. A suggestion, for example, is for GPs or practice nurses to provide annual health checks in community settings that are safe spaces to speak. The current process is not culturally competent. For all young people with a learning disability, we need to improve annual health checks and health action plan awareness in families. Awareness must start earlier than just before the young person is turning 14 years old. For professionals from health, education, and from social care, all need to be involved in providing consistent message. Next slide, please. So raising awareness with families that reasonable adjustments are a person's legal right to ask for this. Healthcare settings must create a safe space for people and parents, for young people with additional needs. The healthcare workforce must be culturally competent. This concerns the language used and a great understanding of the stigmas faced by communities and barriers to using technology, e.g. text messages might not be used or might not be read or used. This project must continue. We still have people coming and asking about it. It's only at the beginning, and a health campaign needs to be created in schools, colleges, and health services. The model for this project can be used nationally, with us leading the way and changing the concept of hard to reach communities to everyone has a level access playing field. Healthcare workers must have a better understanding to distinguish between a learning disability, autism, learning difficulty, ADHD, and so on. This project found professionals at times conflate themselves. There is a need for all professionals to prove accurate information to families and carers to empower them to navigate the healthcare system appropriately. We need to ensure patient groups include people who have a learning disability from ethnic minority communities. We need to ensure the autism independent posters are displayed in all GP waiting areas. Next slide, please. Healthcare information must consistently be available in all other languages. Feedback from the public have said there has been a lack of translated information leaflets. Area-specific focus groups in different community settings across BNSSG to be set up to bring together families, GPs, practice managers, and receptionists. This is to help healthcare professionals to understand the complex issue faced by some communities in a safe space away from healthcare settings. Research into co-production needed on how the ICB could work with families to further the aims of this project. Thank you.
Thank you so much, Sarah. So was there any questions? Rebecca.
Hi, sorry. I really appreciate your presentation today. That was really interesting to hear the barriers that face different ethnic groups. The issue I have working in general practice is that there are lots of groups of individuals who are very vulnerable in our communities, and trying to provide a bespoke service for everybody is very challenging. And trying to create equity of access as well can be extremely difficult. The sort of level of support that you're kind of mentioning in your presentation, we'd normally have a support worker for an individual like that. What is available to sort of those groups, and are you able to feed into any sort of support worker network to help?
Nora, you're muted.
Yeah. So can you repeat your question, please?
Sorry, I'll put my camera on so you can see my face as well. What I'm trying to kind of get my head around is, obviously, you know, that we have lots of vulnerable groups with patients with dementia. We have lots of patients, you know, not necessarily with learning disabilities or from ethnic minorities who'd have difficulty accessing our services, and we struggle to kind of provide an equitable access in particular. And normally the sort of level of problems that you're explaining with not being able to read text messages and things like that, we'd normally expect that a patient like that to have a support worker if they were not from the BAME community. Is there any kind of provision for support workers for people with LD in the BAME communities?
I suppose it's starting the conversation, isn't it? And you know, working together in terms of, so at the moment, in terms of the materials that we have created has made a huge impact. So is seeing how can that materials be utilized, I suppose, from our perspective. What we've seen in terms of this particular cohort of this pilot that we've done is understanding that the core issues and then following it through. And we have come across a lot of the families that we work with might not have access to support workers, or might not have access to these particular supporters that are available. And, you know, again, with all the other challenges that have been faced, it hasn't sometimes been a priority. So yes, if there is a support worker available, that could potentially be ways that these issues can be addressed. But yeah, I don't know, Vicky, if you can come in on that aspect as well.
Yeah, so there is healthcare navigators that the ICB commission. However, I think that's definitely useful, but I think there's some easier wins here. So if it was like an easy read format in the information we provide, if it was, you know, it's just simple things like when a person registers at your GP, ask them if they can read English. It's that simple, and use the reasonable adjustments. So I think there's some easy wins first. And then the big ticket item would be let's employ some more healthcare navigators to support GP surgeries to get these people to access the facilities. But what the overriding theme for this project is, it's not a health problem. If people are living in poverty, they will not care about their health if that person looks well. So we need to sort, if this is a whole system, social care, education is everyone's problem. So if we're really thinking about annual health checks and we need to improve access for everyone, we need a system approach.
Thank you so much, everybody. And this is a great conversation that I think we need to continue in a probably a whole other webinar. Julie has one for future, but we are going to have to move on, I'm afraid. We're short for time. So thanks so much, Nora and Vicky. And I'm going to pass over to Olivia now, who's going to talk about Respect Plus. Thank you.
Hi everyone, I'm Olivia. I'm one of the end-of-life clinical leads as part of Sirona's end-of-life specialist service. So I've been involved in the development of a Respect Plus easy read information leaflet. So I will talk to you about that today. So next slide, please, Chris. So I've noticed a bit of a typo here, so apologies. But hopefully we all know what Respect Plus is. And it is essentially a cloud-based care plan based on the nationally endorsed Respect forms, but it also incorporates advanced care planning and end-of-life care. It's accessible by everyone involved in the care of the patient from both health and social care. And that's to help us obviously guide decision making and delivery of patient-centred coordinated care. And the goal really is to facilitate the planning of personalised care to make sure that our patients are receiving care that reflects their true values, their goals and preferences. And what's good about Respect Plus is that if somebody has a Respect Plus care plan, this will alert healthcare professionals from any setting that someone may have a serious health condition or perhaps has palliative care needs, or maybe they are approaching the end of their life. So there is some ongoing work with making sure that this is embedded within secondary care services at the moment. So we're looking at doing a bit more work around kind of connecting care, getting something quite clear in connecting care. And the hope is in the future that there will be a patient portal so that our patients are able to view their own shared care plans kind of live directly on the portal. Next slide, please, Chris. So this is an example of the PDF of the Respect Plus form. We are working on trying to get it look a bit more similar to Respect forms as we knew it before, so the purple bordered forms. So that is a work in progress, but it says everything on there that we need to know. So next slide, please, Chris. So just a note on respect and health inequalities, really. So we wanted to include specific sections, obviously asking about any cognitive impairment and learning disabilities, but also to include questions specific around reasonable adjustments. And there's plenty of space in the form to document that as well. And there is a specific section to also guide clinicians through assessing someone's mental capacity and recording that really clearly and how the clinician has come to that decision. So we developed Respect forms with support from the National Health Inequalities team. And in addition, we noticed that in the past, cancer patients appear to have been disproportionately represented in advanced care planning solutions, such as EPACs. However, this new solution really does prompt inclusion of people who have any serious illness and moderate to severe frailty. So there's some positives there. Next slide, please, Chris. So as part of the ICB, the End of Life Collaborative team developed this leaflet, so a patient and family information leaflet, all about Respect forms. It's actually double-sided. This is just one section of it. So there was quite a lot of information, but this has been developed. It's available on the link that you can see at the bottom of the slide via St. Peter's Hospice. And we identified that actually there's a need for us to be able to provide leaflets and information to people in an easy read format. And there were discussions about whose responsibility is this, who is going to do it. So I kind of volunteered to take this under my wing. So on to the next slide, please, Chris. So working with our accessibility officer in Sirona, having conversations with Sean from CLDT and also hospice consultants from St. Peter's Hospice, we came up with the Respect Plus plan information leaflet in an easy read version. So Chris, are you able to share the leaflet on the PDF, please? Thank you. I can't see it at the moment. Aha, there we go. Thank you. So this is what we have developed.
Could you share the presentation for us, please?
Yeah, I can. Just quickly to add, if any of you guys have got any questions, if you just pop it in the chat, and then I'll either interject to Grace, or we'll answer them at the end.
I think they're accidentally playing the video on Vimeo from earlier, so just close Vimeo.
Chris, shut down Vimeo.
Cool. So if we go on to there we go. So this is what we have. We'll just have a quick flick through, but we have tried to align it to other accessible information leaflets, in that we've broken down the important words that we have used. We've used images and tried to keep words to a minimum as best as possible. So we've got definitions here, and then we explore what the Respect Plus care plans are. So what is next in terms of this form? We can start using this form, but we are currently waiting for a specific piece of software to kind of run this through, and then the accessibility information standards logo can then be added to it. So once that is done, we will be getting this available on Remedy for people to use, so you can download it, print it off, and use it to help support those conversations. But yeah, I think it's clear, it's concise, and we've made sure to use photos and pictures from the same kind of web sources, so there is consistency across the organisations as well. At the bottom, we've also included some contact details and further information as well, linking to the RESUS website, where the RESUS Council have their own easy read versions, going into a bit more detail, but that's obviously more to do with Respect, the national purple form. That's great. Thank you, Chris. If we could pop back to the slides. So yeah, that's our next steps really, is to get this piece of software, get the correct logos on there, and then it will be up on Remedy and obviously Sirona's internal website as well. And it will be put onto St. Peter's Hospice website, along with the kind of standard patient and family information leaflet. So yeah, just wanted to raise that awareness there. Thank you very much. Has anybody got any questions?
Thanks, Olivia. Whilst Chris figures that out, if anyone has got any questions, we've got some space now.
It was a whistle-stop tour.
And what you were saying about consistency as well, around consistency of how you use in photo symbols and the word news. There is a future project coming from Sirona looking at photo symbols dictionary. Oh, someone's just asking, can you say briefly what the difference is between Respect and Respect Plus?
Yes, so Respect is obviously the nationally endorsed emergency care plan, and that focuses mainly on kind of CPR status, more about emergencies, care in an emergency. Respect Plus is a bigger document. It's looking more at advanced care planning, so really thinking about the future. It includes information about what someone's priorities might be in their last days of life. Have they got any anticipatory medications prescribed, where they might be kept, what other care agencies are involved. So it's very thorough. There's a lot more opportunities to explore kind of further details with people, rather than just focusing on that emergency care and treatment.
Perfect. Yeah. Photo symbols dictionary, we want to be consistent across the whole system about how and what symbols we're using, so that if someone has a piece of information that says about a nurse, every single person uses that same imagery. So it's just another method of reinforcing the messaging and making it as accessible as possible for the largest amount of people. And as we grow that consistency in our messaging, like you've done with the Easy Read for Respect, that will make it easier. So thank you so much, Olivia. Chris, if we can go on to the Stomp page, I believe Dr. Goddard's just popped in, and she's going to talk to us briefly about Stomp.
Thanks, Sean. Hi, everyone. My name's Oriel Goddard. I'm a psychiatrist working in learning disabilities. I'm S25. I work in Bristol. I'm we've been working on STOMP within the CLDT, within the Learning Disability Service, over the past few years, but I'd like to try to kind of expand that and support where possible for people that are under primary care. So there is, you may probably already know, there is some guidance on remedy for STOMP. So this is, there's one particular guidance document. This is kind of the cover page for the document. If you go to the next slide, Chris. And then there is, so this is developed by NHS England. So it's the same kind of flow chart across all areas in NHS England. So this is kind of currently a suggested approach to take with reviewing somebody's medication. So deciding whether a medication could be stopped, and then attempting a first reduction. And then depending on whether the person is settled or not, you could either attempt further reduction, or if not, then you may want to consider referring into the learning disability team to psychiatry. So this is kind of a suggested approach. Obviously, everybody is different. And then this this document, if you go to the next page, Chris, there's some further guidance on how you might approach deprescribing for patients on psychotropics. So focusing on kind of slow reductions, some description of what discontinuation effects you might expect, and how you might manage these. So just, I think that we're going to be speaking more about STOMP later in the year. So I just wanted to bring your attention to what's available here now. And actually, I was hoping to get some feedback on your experience of STOMP so that we can see what else could help. So I have a kind of a QR code feedback form on the next slide, and hoping that you might be able to complete this. There's maybe 4 or 5 questions, should take just a minute to do. And with that information, and I realised that recently you've had to submit data on antipsychotics for people with learning disabilities. So with the data from the questionnaire and the data that's been gathered across BNSSG, we'd like to look to see what's possible in terms of supporting you and the Learning Disabilities Service with delivering STOMP. So it's very early days at the moment, no fixed plans, but in this early stage, some information and feedback from yourselves, from all GPs working with people, would be really helpful. And I just wondered whether it might be possible for you to, whilst you're still on the call, complete this survey very quickly, if that would be all right, Sean, to allow just a minute for people here to complete that. It should really only take a minute.
Yeah, that's fine. I dropped the QR code in the chat. We're just going to, Chris, you move on to the next slide. We'll just stop for questions as well while people are completing that. If there was any questions for Dr. Garland around STOMP or anything else that we've covered throughout the whole of this webinar, we are coming to the end now. So this is just a kind of final opportunity to open the floor for discussion simultaneously as you take a look at that.
Can I just ask, is there a direct link to the questionnaire not via Google, or does it need to go? Okay, don't worry. Just we have to sign in. It's a bit.
There will be. We can find it and send it after.
I don't think this is a 2-minute thing.
Fine, we can send it after. Okay. Next slide, please, Chris. So just another plug for our advice and guidance line in the LD team. So this is available to everybody in the system. It's Monday to Friday, 9 till 4-ish. You've got a whole MDT support in it, from psychiatry through to nursing, OTs, physios. And if you need any support around any of your patients, or you want general advice around how to support people with learning disability in your practice, you can call or email. One of the big bonuses of the advice line is if you call up with consent of the patient, and it's kind of agreed that a referral is required at that point in time, we can generate a referral over the phone without you having to fill in any paperwork. And so that would save some time and effort and energy, and we can make sure that you get the best advice and signposting if it's not an appropriate referral as well. So also kind of avoiding those referrals that don't make it into our service either. Next slide, please, Chris. So next, we're going to continue our quarterly webinars. I believe we'll probably try and get one in at the end of the summer, later on this year, and I think we'll focus that one on mental health, challenging behaviour, and probably have Dr. Goddard back as well, talking some more about STOMP. Just another nudge really for everybody, but Oliver McGowan training for everybody within health and social care needs to get that completed. So the links in the slides, and please ensure that your staff teams are getting that completed. If you want to join our mailing list for any future events that we're doing, please just drop myself or Juliana an email, and we can make sure that you're included in our mailing list, and those that want to be involved in the annual health check kit tool annual health check toolkit trial, please drop me an email, and we can include you in that as well. And something just hot off the press that it wasn't on the slides, but I have Deb Moore on the phone call with us. She's one of our learning disability nurses within the LD team. She just wants to say hi and pass over a new role that she's doing.
Hi everybody. Yeah, my name's Debbie, and I've worked in the I'm a community nurse in the learning disabilities team. I've worked here for 14 years, and as part of my role, it's just developed into something a little bit different. So I'm going to be the link for primary care. So I just wanted to introduce myself, just to say that I will be in touch with each practice, just so that we can see how we can support you, your practice, from our team. So I'll be in touch.
Thank
Cheers.
you, Deb.
Thank you.
And then last slide, please, Chris. So that does bring us to the end of our webinar today. I've dropped some feedback form in the chat, and there's also the QR code on the screen if that's what you prefer. Just want to say a big thank you for giving up your time today and attending the webinar, and I hope that you can take away some practical solutions to everyday challenges we're facing. And also thank you to our speakers for giving up their time as well to come and present today. It's been thoroughly enjoyable. Lots of good discussion, and I think we've got a few topics to take away and think about for future webinars as well. With the feedback form, if you do fill it out, there's an opportunity in there to guide us on future events as well. So if you fill that in, you can have a say on any future topics you'd like covered. So thank you very much, everybody, and we will finish near enough on the dot 2 o'clock. Thank you very much.
Thank you all.
Thank you, everyone. Bye-bye.